Welcome to Emend Healthcare. Working in a residential facility is deeply rewarding, but it requires vigilance. At any moment, a standard day can pivot into a sudden, unpredictable crisis. In our setting, these crises take two primary forms. You might encounter an acute physical emergency or a severe psychiatric episode. To handle either situation, we use a specific set of tools. We rely on a universal response protocol. We actively investigate behavioral changes to unmask hidden medical emergencies, and we use a clear framework to intervene in active suicide risks. Knowing these exact steps provides a vital framework during a chaotic situation. Having a structured process helps you act with clarity when speed and precision matter most. Before we look at the steps, there are two unbreakable rules at Emend. First, you never need a manager's permission to call 911 for a life-threatening situation. Call first, report to your supervisor second. Second, our staff are strictly prohibited from physically restraining violent clients. We are a non-medical setting. If de-escalation fails, your job is to protect everyone and let law enforcement handle physical intervention. This diagram outlines the 6-step universal protocol. When an emergency does happen, we run this exact sequence every time. Step 1 is scene safety. Remove dangerous objects and clear other clients out of the area. Step 2 is assess. Check if the client is conscious and breathing, and take vital signs if it is safe to do so. Note the exact time. Step 3 is call for help. Dial 911 for life threats, then contact your supervisor and the on-call prescriber. Step 4 is intervene. Apply first aid or de-escalate within your scope, and never leave the client alone. Step 5 is communicate. Tell 911 the facility address, the client's current vitals, and what is happening right now. Step 6 is document. As soon as it is safe, record the timeline, vitals, and exact client statements in a progress note. Committing this loop to memory gives you a reliable structure to fall back on. This standardized approach helps you move through a crisis efficiently while aligning your actions with facility and regulatory standards. That assessment step is crucial because of a phenomenon called medical mimicry, where a severe physical issue looks exactly like a psychiatric relapse. It is easy to see a client suddenly become confused, agitated, or paranoid and assume their mental illness is simply acting up. That assumption can be fatal. This mapping illustrates the overlap. A sudden spike in agitation might actually be severe hypoglycemia. New confusion and slurred speech can easily be lithium toxicity, an infection, or a stroke. This dictates our clinical response. Anytime a client exhibits a sudden, unexpected change in behavior, you must take their vital signs to rule out physical trauma, toxicity, or a metabolic crash. Vital signs give you objective data. Checking them is the only reliable way to separate a standard psychiatric episode from a life-threatening medical emergency. We apply that same need for objective data to assessing active suicide risk. We look for 5 distinct situational markers. This layout shows the criteria for an imminent crisis: access to lethal means, a specific plan, clear intent to act, preparatory behavior like giving away possessions, or a recent attempt. Any one of these requires immediate action. If you identify these markers, assign continuous one-to-one observation immediately. Stay within arm's reach of the client and do a physical sweep to remove all hazardous items from the area. Speak to the client plainly. Ask direct questions like, "Are you thinking about killing yourself?" Do not minimize their pain or argue with their logic. Just listen and gather information. By asking direct questions while maintaining close physical proximity, you gather the critical information needed to manage the risk while coordinating with your supervisor and the 988 lifeline. Let's apply these rules to a few real-world situations. Imagine a client with schizophrenia tells you the voices are ordering him to harm the person in the next room. Your first priority is scene safety. Quietly move the potential target to another area without raising an alarm. Maintain a safe physical distance from the agitated client and use calm language, acknowledging that you want to help him stay safe. Notify your supervisor immediately. If the client escalates and moves toward the other person, do not try to physically block him. Call 911. In a different scenario, you find a client barely conscious on the bathroom floor, with an empty, recently filled pill bottle beside them. This requires an immediate medical response. Dial 911, then call poison control for guidance. Roll the client onto their side into the recovery position to keep their airway clear, and secure the empty bottle to hand off to the paramedics. In both cases, relying on a structured, objective process prevents the situation from spiraling. It keeps you focused on clear, actionable steps. An emergency isn't fully resolved until the documentation is filed. For critical incidents, like a suicide attempt or a severe injury, the facility must submit an LIC 624 report to Community Care Licensing by the next working day. To summarize, run the 6-step universal protocol every time. Take vital signs whenever a client's behavior changes suddenly, and actively screen for the 5 markers of suicide risk. Remember your absolute boundaries. Never wait for permission to dial 911, and never attempt to physically restrain a client. Facing an emergency is demanding, and it is entirely normal to feel stressed when one occurs. But you have the exact protocols you need to handle it. By pairing a calm, steady presence with strict adherence to these steps, you protect everyone in the facility. You are ready.